Hey, what is going on, everyone? Jomar Farrales here, Doctor of Physical Therapy. I wanted to talk to you guys today about what to expect after having a knee replacement. A knee replacement is a very common orthopedic procedure that is done hundreds and thousands of times every year. And I've seen countless amounts of total knee replacements working in home health as well as in the outpatient setting. But before I delve into what to expect after a knee replacement, make sure you go ahead and hit the subscribe button below, hit the like button, comment, share, and let's get right into it. So typically after a knee replacement, you're going to expect number one, pain. I think this is kind of like a given. You will have pain, but it's a lot of times it's post-surgical pain. It's pain that is normal to have, especially after a knee replacement. If you've ever seen a knee replacement before, or at least like a video, you know that the orthopedic surgeon is testing that knee out and really putting that knee through a full range of motion. So that can cause a lot of soreness. And then obviously, like with cutting through some tissue, it's gonna be painful after the surgery. However, you should also expect some mild to moderate swelling. This is another normal process that can happen after a knee replacement. Is you will have some swelling around the knee joint, even a little bit maybe in the calf. However, swelling is also a normal process after having a knee replacement. So another thing to expect after surgery is that you're gonna have a limited range of motion, especially right off the bat. You're gonna have a hard time bending the knee and straightening it out, but that's where having a home service such as therapy come into the home and work with for a little bit is a good thing, so that you can do some exercises and they can show you some stuff to make sure that your knee heals right after the surgery. Another thing to expect after surgery is the surgeon is going to put you on some pain medications, as well as some maybe other meds to reduce blood clots and to improve your ability to pass your bowels, since you may be on some narcotics that can cause constipation. So what are some of these pain meds? Usually Tylenol and oxycodone. Those are a very common combination of drugs used after surgery. Also, as far as any laxatives, you might be put on some type of laxative, stool softener after surgery as well. And then a medication for blood clots, usually a baby aspirin sometimes, but it all depends on your risk factors. So your surgeon and their team will decide what meds you should take after having a knee replacement. Also expect to be using a walker and some type of assistive device for at least the first initial phases while you return home, because the last thing you want is a fall or to lose your balance, and right off the bat your knee is going to feel weak, especially after the surgery. All right. There's going to be a non-removable dressing that usually is taken off at your next follow-up after the surgery with the orthopedic. And so a little bleeding into the dressing is normal, okay? But however, if there is an excess of bleeding, or if your knee joint swells up and is super big and you've got pain in your calf, you're probably looking at like a DVT or some type of blood clot. So those are the red flags. However, mild to moderate swelling, increase in pain, decreased range of motion, warmth, and some pain, those are things that are expected, especially after this surgery. So those are a few things to expect after a knee replacement. I will be coming out with more content on topics similar to this. So if you enjoyed this video, please hit the subscribe button below, and feel free to like, comment, and share this video to anyone who you feel would benefit, or if you are going to be undergoing a knee replacement, this is kind of what to expect. All right, guys, so I will talk to you later. Have a great day.